we'll continue our lecture video on the skeletal system, talking about joints. The term articulate means to describe the motion that occurs when two bones come together. But when two bones come together, they don't always move against one another, so there's different types of joints that we can describe based on their movement. And looking at the three types of joints, we have fibrous joints, cartilaginous joints, or synovial joints. So fibrous joints are those that are immovable. So they are the sutures of the skull that I talked about earlier, those lines between the different skull bones, between the frontal bone, the parietal bone, and the occipital bone, temporal bone. Those are all called sutures. So there's where two joints come together, but there is not any movement there. So cartilaginous joints are joints where bones are connected by hyaline cartilage or fibrocartilage. So we talked about the costal cartilages of the ribs. I'll pull up a picture here that we looked at. The costal cartilages are here where the ribs meet the sternum. So that's a cartilaginous joint. Another example are the intervertebral discs here. So this is another type of cartilaginous joint. So these two bones come together, but there's fibrocartilage that separates them. So when there's cartilage separation between those bones, that's a cartilaginous joint in this case. So they're not freely movable, but there is some movement, some flexibility because of that cartilage that separates the two bones. So that's the cartilaginous joint. So those allow for a little bit of movement, but not near as much as the synovial joints. Synovial joints are freely movable. The bones are free to move against one another. There is cartilage between there as well. It's hyaline cartilage, and that's the same as we find in the costal cartilages of the rib. So it's not hyaline cartilage that defines the synovial joints. It's the fact that they're freely movable. So cartilaginous joints are slightly movable. Fibrous joints, like the sutures of the skull, are immovable, not movable at all. So it's the synovial joints that have more free range of motion. So if we look at a typical synovial joint, we'll find those, for example, in the knee and in the hip, in the shoulder are some good examples that there's bones coming together there, and there's free movement in all different directions. So when we look at a typical synovial joint, there's some things that we'll find there. We'll find a space between the two bones that is filled with fluid. We call that the joint space, and it's surrounded by ligaments on the outside, which forms a joint capsule. Then there's a membrane that lines the inside of the joint capsule. That's called the synovial membrane, and there's special cells that secrete synovial fluid into that space, which allows for lubrication. If you've ever injured your knee or your shoulder, sometimes you can see it, especially knees or ankles, they get swollen because of excess inflammatory substances entering that joint space and causing excess fluid in there. So then that can kind of inhibit movement. But if we have just the right amount of fluid, that allows for good movement. And then there's what we call bursa, and these are fluid-filled sacs we find in the joint that provides extra cushioning. And some people with too much movement, or maybe sometimes not even enough movement of the joints due to lack of activity, they can end up with something called bursitis, and that's where the bursa gets swollen and rub more than they should against the structures of the joint and causes a lot of pain with movement. So people have to really be careful with activity, that their joints are lined up correctly, that they have good form. Like if a person's going to start a running or walking routine, it's important to have good shoes and good form when running or walking to make sure the joints are maximizing what they've been designed to do, and they're not rubbing in the wrong direction. We also have menisci that we find between particularly the knee joint. It's C-shaped cartilage that the femur bone sits into the top of the tibia to form that knee joint. The menisci provide cushion and stability. So if a person has a torn meniscus, they'll find that the knee feels loose and unstable, and sometimes that requires repair. So if we look at some of these structures here, we can see the meniscus is this C-shaped cartilage that are found down in here in the joint on either side. They're cup-shaped structures that sit between these two bones. This is the bone of the femur, and this is the tibia here. So there's cup-shaped menisci that the femur sits in to provide that cushion, and it prevents a twisting motion as well based on its shape. And we also have ligaments that run on the outside of the knee. Those are the collateral ligaments on the outside. And then we also have ligaments that run from the back side of the femur to the front side of the tibia. They cross over in between these two bones, and those are the cruciate ligaments. Maybe you've heard of the ACL. That's the anterior cruciate ligament and the posterior cruciate ligament. Those ligaments provide stability, and if the knee gets a strong twisting motion in the wrong direction, that can cause a tearing of the ACL. But regardless of all the structures, they have these same structures regardless of the type of joint, they have these same structures in common. So we can see that the movement of a joint may differ. For example, when we look at the shoulder and the hip, for example, that's a ball and socket joint. The shoulder and the hip, that can rotate in all directions. However, the elbow joint here is a hinge joint, which only allows an up and down motion, not a completely circular motion like we would see in the hip and the shoulder, because the bone on the end of the bone of the shoulder joint, the humerus here, has a rounded head which allows for a rotating motion. The same thing with the head of the femur as it sits in the hip. It has a rounded head for rotational motion. When we look at the elbow, it only allows for an up and down. The rounded head of the radius here, though, does allow for movement of just the lower arm, for example, if you're turning a doorknob. So again, rotational movement is a ball and socket joint. Hinge movement is just an up and down, so the elbow and the knee are good examples of that. And these are just some terms that we use related to joint movement. Flexion means that we are bringing the end of the joint closer to the midline. So when you flex, you're decreasing the joint angle. So when you bring your toes to your nose, that's an example of flexion. Extension is when you're stretching out and pointing your toes. So that's taking it away from the midline or away from the main frame of the body. So we're making a larger joint angle when we're extending. Adduct means you're moving it toward the midline. So you're moving the body part, away. No, let's start here. When I move in this direction, we call that adduction. So we're moving the body part toward the midline. So if you put your hands out to the side and you bring them down against your body, that's an adduction movement. Abduction means we're moving the body part away from the midline. A way to think about that is when we say that something has been abducted. Like if a child is abducted, it means the child is taken away from the parents. So to abduct means to move the body part away from the midline. So it's important to know these terms, because if you ever go to a gym, for example, and they'll have the adductor machine and the abductor machine. Different muscles are going to move the arm toward the body versus away from the body. So it depends on which muscle group you're looking to work if you want to use the abductor machine or the adductor machine. Ideally, you want to use both. And then we have terms called supination versus pronation. Pronation means it's facing down. So if you take the palm of your hand and face it down toward the ground, that's called pronation. Supination would be taking your hand and facing the palm toward the ceiling. So that's supination. And then circumduction is when we move the body part kind of in a circular motion. We call that circumduction. And inversion is when we would be walking, for example, on the outsides of our feet, and eversion would be walking on the insides of your feet. So all of those motions are terms that we use to describe motion of joints. Some disorders of the skeletal system are listed here, and that is part of, some of these are part of your discussion board this week, so I'm not going to talk too much about that. Just understanding the difference between osteoarthritis and rheumatoid arthritis. Arth means joint, so osteo means bone, so bony joints. Itis means inflammation. So these are, the term osteoarthritis refers to inflammation of bony joints. And rheumatoid arthritis is an autoimmune disease where suddenly the body attacks the joints and causes chronic inflammation, damage, and deformity over a lifetime. So it's a very serious condition when people have been diagnosed with rheumatoid arthritis, and it's important they take medications to control that attack on the joints. Osteoarthritis can happen with aging. It is a hereditary condition, and it can also be caused by overuse. People that played a lot of sports when they were younger, like football, professional athletes, for example, football players, basketball players, and also runners who don't know or aren't very good at taking breaks between running or taking a little time off or listening to their body. They can end up damaging their knees with excessive running. But mild running, at a reasonable pace and with breaks in between, is actually good for the joints. So it's a myth for those that say running is bad for the joint. It depends on the type of running. Light running at a reasonable pace can be very healthy and good for the joints. So when you look at cells in the skeletal system, the structural and functional unit of the skeletal system, it's the osteocytes. Osteocytes are bone cells, and they are the living part of bone. Bone is a living tissue, and these cells need nutrients, and they maintain the bone. They're bringing in nutrients and giving off waste and maintaining that healthy bone. So those are called osteocytes. They're mature bone cells that maintain bone. Osteoblasts are bone cells they form bone. Their job is to make new bone. So they take calcium from the blood and they combine it with phosphate and harden the bone tissue and make that hard, compact, and spongy bone. So osteoblasts build bone. That's a good way to kind of remember. The B means build. Osteoblasts build bone. And then those osteoblasts, some of them will turn into and mature into these osteocytes. So osteocytes don't necessarily build or break down bone. They just maintain the bone once it's been made by the osteoblasts. Then there's another type of cell that we find in the skeletal system, and that's osteoclasts. These are like cleavers. They break down the bone. They break down the bone to release calcium and phosphate to the blood. For example, if you're not getting enough calcium in your diet, these osteoclasts are stimulated by a hormone called parathyroid hormone that is released with low calcium levels. So if we don't get enough calcium in our blood, these osteoclasts will break down bone to release that calcium, because we need calcium for muscle contraction and for nervous system function. So the body really relies on calcium for those important functions, and it will break down the bone to get the calcium it needs if the calcium is not coming in through the digestive tract. So it's very important that women and men both get enough calcium throughout life in their diet. Some women even need a calcium supplement. And we do know that osteoblasts are stimulated by weight-bearing activity. So if a person lives a sedentary lifestyle and doesn't get enough calcium, especially females, they're very much prone to osteoporosis, and bone fractures, like hip fractures, are the most common because of the pressure of the upper body on that hip joint. Particularly, it's the head of the femur that breaks due to osteoporosis, and that's just thinning spongy bone. And there's a picture later on that shows that process. So when you look about bone growth, looking at bone growth and how they get longer in length, there's a special layer of cells, cartilage cells, in the epiphyses of our long bones, and this is called the epiphyseal plate. Another name for it is the growth plate. So these cells will produce more cartilage on one end and more bone on the other end. So if we look at a kind of a blown up version here of the epiphyseal plate, we'll see that this side of the plate is turning into bone, and this side of the plate is growing more cartilage. So the thickness of the plate doesn't change during childhood, but we can see it's adding bone on this side, but it's adding cartilage on this side. So as it adds bone, that is going to increase the length of the bone at the epiphyses. But then osteoclasts are going to work to make sure the medullary cavity here stays constant. It's going to cleave out that inside portion to make sure that it's a uniform bone, just like it was, before the growth occurred. So this process of growing in length occurs throughout childhood and puberty, and it's complete about, age 18 for girls, sorry, about 18, and then for boys about age 21. Now there's individual differences of when that growth is complete, but that's about the age that boys and girls are done growing. So 21 for boys and 18 for girls. So it's all about this activity at the epiphyseal plate, because once a person is done growing, what happens is this bony process, this ossification that occurs on this side, will continue until it's completely replaced by bone and there's no longer any cartilage here. So the cartilage side here on the top portion stops growing, and then the epiphyseal plate is done and complete, and it just becomes a line of bone with no more cartilage. Then we know that growth is complete. So a doctor can take an x-ray, for example, of a teenager's bone, and it can tell them if they're done growing or not, if that epiphyseal plate is no longer present and there's no cartilage there. So other hormones that play a role other than estrogen and testosterone, we know that vitamin D is important. Vitamin D helps to absorb calcium from the digestive tract, so we need to make sure we have good intake of vitamin D as well. Growth hormone and thyroid hormone are also two important hormones that play a role in the growth of our bones and strength of our bones. So it's important, throughout life that we have good doses of these hormones. As women age, though, they start to lose estrogen as their ovaries decline in their function and stop producing estrogen. Then women are at risk for osteoporosis because they don't have the influence of that estrogen to stimulate those osteoblasts to make more bone. As a result, it's important that women get weight-bearing activity, because that stimulates osteoblasts. Things like good walking and mild running are good forms of weight-bearing activity after menopause, because estrogen is no longer available to help with that growth. So osteoporosis then again is when we have decreased bone mass because of osteoclast activity is outpacing osteoblast activity. So that increases for women after menopause. And if the earlier they enter menopause, the more at risk they are for osteoporosis. And we find that thin Caucasian women or white women are at risk. Asian women as well are at risk because they don't have as much weight-bearing activity because of their thin body frame. And also a sedentary lifestyle, again, they're not stimulating those osteoblasts with that weight-bearing activity. And if they don't get enough calcium and they have a diet with drinking a lot of coffee or alcohol, and in addition to smoking, those are all things that break down bone and increase the risk for fractures and early death. Because when an elderly woman, breaks a hip and ends up hospitalized for a long time and is very weak and then has to go to a nursing home, oftentimes they will become so deconditioned that they don't recover and they pass away. So hip fractures can be a major cause of death for people that are very thin and are not healthy, again, as a result of poor diet, smoking, alcohol, and caffeine. So this is what a bone looks like, the epiphyses. Again, this is the ends of our long bones. This is what that spongy bone should look like. But if they're not getting enough calcium, then remember that calcium will be released to the blood from osteoclast activity, breaking down the bone to make sure that the nerve and the muscle gets the calcium it needs to function and keep the body alive. So the bone gets weaker and weaker. And it's not that a person broke their hip after a fall. What happens is they'll be standing maybe at the kitchen sink and their hip breaks, which is the head of the femur. So the head of the femur breaks and they fall as a result. So it's not that they fell and broke their hip. They actually broke their hip and fell. So women will describe a feeling of a crack as they start to fall toward the ground. So if we kind of zero in here, what breaks in osteoporosis, when we talk about breaking a hip, the hip is not a bone. The hip is the joint created from the femur coming in here to the acetabulum of the ilium and the ischium where they come together. and the pubis form this cup-like structure called the acetabulum. So where that head fits in there, right here, is spongy bone, and this weakens with osteoporosis. And if this neck right here, this neck of the femur, if that neck breaks, there's nothing to support this whole torso on this femur bone, and that's going to cause a person to fall. And what will have to happen then, they'll have to replace this whole head, neck, and top of the femur here to repair that joint. And that's a pretty substantial surgery, and that's where I said women can get deconditioned, and it can eventually cause death, depending on how deconditioned they are when this injury happens. So that's where the break occurs, is right there at the neck of the femur. So that concludes our discussion of the skeletal system lecture. We'll pick up next time with the muscular system.